everyone, I'm Dr. Huma Sheikh. I'm a headache specialist here in New York City, and today I want to talk to you about a migraine toolbox. This is a set of strategies, treatments, and lifestyle techniques that you can use to help take control of your migraine. If you have ever felt overwhelmed by migraine, what to take, what to avoid, what treatments to try, this can help you develop a framework so you can start to take control of your migraines. So what is in our migraine toolbox? The migraine toolbox consists of three very important categories. The first are acute medications. This is something once you already have a migraine. This includes over-the-counter medications like Tylenol, Excedrin, caffeine, and then it includes a lot of different prescription medications like triptans, Gepants, Ditins, and there are also a few neuromodulation devices that can be used as an abortive. The second category is preventive medications. These are things that you can do to try to prevent how often you get a migraine attack. So these are preventive medications. They can be specific like the CGRPs, or they can be non-specific, things like Topamax, beta blockers. There's a whole range of medications, and it's important to try to figure out which one or which combination of medications might be most useful to you. There are also lifestyle strategies that are very important in preventing migraine. This is focusing on the big things that can be triggers, like your sleep, your stress level, your exercise, and especially your food. What you consume, they might be triggers, but they also might be overall causing inflammation that can worsen your migraine. And the last is lifestyle or complementary treatments that can really decrease how often you're getting a migraine, and they're also really helpful for your overall wellness. These are things like yoga, mindfulness, meditation, cognitive behavioral therapy. These are things that you can add on to your preventive medications and your abortives that is going to all together bring your body into homeostasis. This is really the biggest thing with migraine. The migraine body needs balance and homeostasis. When anything is off, a migraine is your body's way of telling you that your body is not balanced, it's not in homeostasis. So to try to figure out how best to control your migraine, it's important to figure out what things are off balance for you. Is that your sleep that's not good quality? Is it your stress levels that are causing your cortisol levels to increase? Helping you figure out what is off balance can really help to decrease migraine. You want to think of migraine as your body's way of telling you something's not right. Because what happens when you have a migraine? It's your body's way of resetting. You go into a dark room, you want to just sleep, and it's your body's way of telling you that something is off. By figuring out what it is that is off balance, you can really start to bring your body into homeostasis. And that is why one of the most important things in migraine treatment and your migraine toolbox are the self-care tools that you have. How are you taking time to take care of yourself? Things like I mentioned, yoga, mindfulness, acupuncture, all these things can be very, very helpful in decreasing your cortisol levels, in decreasing inflammatory factors, and this overall can also really help your migraine. It's really also important to keep a headache diary. That can be very helpful in figuring out what some of your triggers are hormones your trigger, is weather a trigger for you, and the headache diary can really help you sort out what takes your body from being in balance to now being off balance. So if you want to learn more about each one of these things in our toolbox and how you can figure out the best combination for you, please subscribe, follow, like, and please add a comment about what you want to know about your migraine and how to take control of your body and treat your migraine.